life after TB. So, what happened to me was I was TB cured during September 2017. But that was not the end of it. Right after I got my report, I did a scan just to assess how my condition is. And then when the reports came, it came out that one of my left lung is completely collapsed. This whole time, I fought TB only to realize that TB had permanently damaged my body in a way that my right lung was compensating the entire process of treatment and everything. It was, it do all the work for me. So this is also such a difficult thing for me to, the thought of it is difficult for me. And then I remember I went to show my report to the doctor, and when the doctor saw it, he was surprised to see me walking by myself alone in his room for checkup. And then I remember him saying that in this condition, looking at you and the report, how do you manage to just come here alone? I was like, I had to, because my mom was sick and we need people to take care of her. As for me, I'm fit and fine and I can walk and I can be here, right? So I remember him telling me that you have to go to this other hospital, to a surgeon, where you need to cut it off, take out the left lung, because that will eventually leave a mark on me and it will have effects on my bones. My bones will shrink, and then chances that, I'm not going to live a normal life anymore. So, yes. So what happened? I went to the doctor, visited him, to the surgeon, visited him, and he said to me, Rita, decide if you want to do the surgery. It's either, we take it out and chances are you're going to live only 5 years from now and it's not going to be an easy life. Or either way, you leave it and just see where it goes, because the organ is already dead. It's just going to be a scar tissue there. Yes, discomfort will be there, but we can't say anything what's going to happen next. And then I remember him saying also, even if you do the surgery, in between surgery, complications will be there. With the lack of oxygen, I might go into brain death as well. So you get it, right? Mentally, it's already haunting me. Psychologically, it's affecting me a lot, because I am a woman who already have anxiety and depression even before TB. So with the side effects of the medicines, it's adding up for me. So I remember I had to push myself, all of this. I decided, I was like, I'm not going to do the operation and all, because my mom is bedridden. She was sick at that time. And then who's going to take care of me? Also, even if I'm hospitalized and do the surgery and all. And then I had to make a choice on my own. So I went for counseling. I even went for yoga as well, like for a time being, just to, throw all these fear and thoughts that has been instilled in me. And then later on, somehow I just move on with my life. I tend to forget that I even have only one lung also, right? I mean, look at me now. Can you even make out of it? No, right? So I start to move on with life. And then still, TB hasn't done with me yet, I think. Even though I'm cured, 5 years later, I had some pain in my feet and hand. It was like impossible for me to walk. There's numbness in my feet. So again, I went to visit a doctor, and he got me tested. And then later on, I was diagnosed with axonal neuropathy. It's a condition where, you know, the nerves send the message to the brains to control the muscles, right? So I had to go through that. And now living life after TB hasn't been easy for me. It's always a constant fear for me. If I get fever, if I get coughed, if there's like, if I lost weight, or even night sweat, which is sometimes it's just just a flu or something like that. I'll be so afraid because of what I went through. I was literally malnutrition. I was only 33 kgs back then when I was sick, and now I'm like 70. Going back, the body shaming that I went through. There's so much going on dealing with, the psychological effect that it has affected on me. I've lost years of my life to this disease. I've watched my friends graduated, moved on, married, and even have their dream job, while I was still, struggling with just to breathe. I share my story because no one should suffer in silence, because people deserve better treatment, better understanding. Because life after TB, the complications that come with like minds are real and lifelong. And because one day I hope to see a world free from TB.